Hi, everyone. We did our group presentation on type 2 diabetes mellitus, and my name is Sarah Wallace.
And my name's Grace Watkins.
I'm Bryson Wellborn.
So, what is type 2 diabetes? Diabetes is noticed by an individual's blood sugar levels getting too high. In type 2 diabetes, an individual's pancreas is unable to make the right amount of insulin or use it effectively. And insulin is a hormone that regulates the movement of sugar into your cells. So, a diabetic cells don't respond normally to insulin, and this is called insulin resistance. An individual's pancreas will try to make more insulin so that your cells respond. However, the pancreas will not be able to keep up, which results in your blood sugar rising. And it's a chronic condition, but there are ways that you can manage it. And these ways include eating healthy, exercising, and then also medication. So, symptoms and signs. There are many different symptoms of type 2 diabetes. Oftentimes, they develop slowly, so you don't always know right away when you have it. So, some of the common symptoms include increased thirst, urinating frequently, feeling very hungry even after you've already eaten, fatigue, blurred vision, numbness or tingling in your hands or your feet, and then cuts and bruises that are slow to heal.
So just some statistics on type 2 diabetes. More than 34 million Americans are affected by diabetes. Out of that, 90 to 95% have type 2 diabetes. It most often develops in people over the age of 45. However, more children and teens are starting to be diagnosed with type 2 diabetes. The National Institutes of Health in 2017 saw an increase in Asian Americans and Pacific Islanders, and in non-Hispanic Black youth between the ages of 10 and 19. They saw smaller increases, however, in Hispanic and white populations. So just some tests and diagnoses of type 2 diabetes. There are multiple tests that can be done to diagnose type 2 diabetes, such as the A1C test. This just represents blood sugar levels for the past 3 months. And all of these tests have three categories for them, which are normal, pre-diabetes, and diabetes. Another test that they use is fasting blood sugar test, and this is just one that is taken after an overnight fast, such as at a doctor's appointment. And then they also have a oral glucose test, which is less commonly used, mostly for pregnancies. And you'll be tested periodically over the next 2 months after the first initial one.
So there are some recommendations that nutritionists advise to those who deal with type 2 diabetes. So I'm going to start with what they encourage type 2 diabetes to eat. The first being complex carbohydrates. This is typically foods such as brown rice, whole wheat, quinoa, oatmeal, fruits, vegetables, beans, and lentils. They also encourage them to eat foods with low glycemic load index. And then they also want them to eat things that are protein packed foods because this provides energy with little effect on their blood sugar. This is typically foods such as beans, legumes, eggs, seafood, dairy, peas, tofu, and lean meats and poultry. They do discourage a few things for type 2 diabetics to eat, one being simple carbohydrates. This is sugar, pastas, white bread, flour, cookies, pastries. They also just have a few things they would like them to overall avoid, which is sodas, this being regular or diet, refined sugars, processed carbohydrates, trans fat, high fat animal products, high fat dairy products, high fructose corn syrup, artificial sweeteners, and any highly processed foods. So, a few more considerations that they advise are consuming an adequate amount of fat in one's diet. Fat does not have much of direct effect on someone's blood sugar who is type 2 diabetic. So they can be useful in slowing the absorption of carbs. They also recommend to have superfoods in their diet, which are the chia seeds, wild salmon, white balsamic vinegar, cinnamon, and lentils. A healthy meal plan typically includes plenty of vegetables and limited processed sugars and red meats. The dieting styles that are recommended are typically vegetarian, vegan, ADA, paleo, and Mediterranean, which I'll speak on in the next slide. And then basic guidelines for dieting are typically eating a low glycemic load carbohydrates, and then primarily eating vegetables and consuming fats and proteins that are plant source. So these are the specific recommended diets that I just listed. Vegetarian is they avoid meats, poultry, or seafood. So they typically consume vegetables, fruits, whole grains, legumes, seeds, nuts, and may include eggs and or milk, depending if it is ovo-lacto vegetarian. Vegan is they avoid eating any animal foods as well as any foods that contain ingredients that are derived from animals. So they typically consume tofu, tempeh, legumes, seeds, nuts, whole grains, and plant-based foods. Paleo, they avoid processed foods, sugar, soft drinks, grains, most dairy products, legumes, artificial sweeteners, vegetable oil, margarine, and trans fats. So they typically consume meat, fish, eggs, vegetables, fruits, nuts, seeds, herbs, spices, and healthy fats and oils. Mediterranean, they avoid refined grains, refined oils, and foods with added sugars. So they typically consume vegetables, fruits, legumes, nuts, beans, cereals, grains, fish, unsaturated fats such as olive oil, and then low intake of meat and dairy foods. And ADA, it differs by case situation. They typically, ADA just recommends one of the ones that I just listed above.
So some recommended physical activity for type 2 diabetics. The ACSM and ADA recommend at least 150 minutes of moderate to vigorous activity per week, along with resistance training. Before this, though, they go through a screening process to eliminate any risk for cardiovascular diseases. Then they'll have a discussion regarding what type of physical activity the patient should do. While screening, it is recommended to ask questions such as what the patient enjoys doing, just to make the exercises as enjoyable as possible, just to help motivate them and to keep them doing it. It's also recommended that the patient incorporates warm-ups and cool-downs in workouts just to reduce the risk of injury, to help motivate them more and to just keep them enjoying the workouts as much as they can. Resistance training is recommended to be done 2 to 3 times per week, working major muscle groups.
So this is one of the articles that we found. The title of the article was Factors Associated with the Knowledge of Disease in People with Type 2 Diabetes. So basically the article just discussed the factors associated with people who have type 2 diabetes. In the article, it discusses clinical data and a study that they conducted over a population. The article also includes things, details on objectives, method, and the results of the study that they conducted. This was our second article, which was titled Type 2 Diabetes Knowledge and Self-Management. This article basically discussed the lifestyles of individuals who deal with type 2 diabetes, and it provides input on how to self-manage the disease. The article also does include tests that they conducted, which also includes their statistics, their charts, and they also provide advice for healthy practices. And then this was our third article. This was titled Glucose and Protein Metabolic Responses to an Energy but Not Protein Restricted Diet in Type 2 Diabetes. This article basically just discussed how insulin sensitivity of glucose and protein metabolism in adults that deal with type 2 diabetes. The research involved a study that they conducted on individuals, which allowed them to provide charts and statistics and information on the effects of glucose and protein in one's diet. So the results appeared to be positive in multiple ways. There was only some slight concerns in the studies that they conducted.
So this is our 5-day menu. This is day 1. For breakfast, we have 1 cup of 2% milk, an egg sandwich, so 1 egg on a whole wheat English muffin, and a half a cup of strawberries. And then for the morning snack, we have water to drink with 1 rice cake and 1 ounce of peanut butter. Then for lunch, we have 1 cup of 2% milk. And then we have a taco, so 1 corn tortilla, a half a cup of cooked black beans, 1 ounce of low fat cheese, 1 ounce of avocado, 1 ounce of salsa, and then 1/4 cup of mango to go with it. And then for our afternoon snack, we have water to drink with 3/4 cup of carrots and 1/4 cup of hummus. And then for dinner, we have 1 cup of 2% milk, 2 ounces of chicken breast, a half a cup of whole grain pasta, a half a cup of broccoli, and 1/4 cup of watermelon. And then this is day 2. So for breakfast, we have a cup of 2% milk, a cup of whole grain cereal, and then a banana. And then for snack 1, we have water to drink with 5 whole wheat crackers and 1 ounce of cheese. And then for lunch, we have a cup of 2% milk and a turkey sandwich, so 2 slices of whole wheat bread, 2 ounces of turkey, and then 1 tablespoon of mustard. And then to go with it, we have a half a cup of carrots and 1/4 cup of blueberries. For the afternoon snack, we have water to drink with a half a cup of low-fat vanilla yogurt and a half a cup of raspberries. And then for dinner, we have 1 cup of 2% milk, 2 ounces of salmon, a half a cup of green beans, 1/3 a cup of brown rice, and 1/4 a cup of pears. So day 3, for breakfast, we have 1 cup of 2% milk, a breakfast burrito, so 1 whole grain tortilla, 1 scrambled egg, 1/4 a cup of spinach, and 1 ounce of cheese. And then to go with it, we have a half a cup of blueberries. Then for snack 1, we have water to drink, and then we have an orange and 1 ounce of almonds. So for lunch, we have 1 cup of 2% milk, and then a tuna sandwich, so 2 slices of whole grain bread, 2 ounces of tuna, 1/4 a cup of grapes, and a half a cup of snap peas. For snack 2, we have water with 3/4 cup of celery sticks and 1 ounce of peanut butter. And then for dinner, we have 1 cup of 2% milk, 2 ounces of pork, 1/4 a cup of broccoli, a half a cup of broccoli, 1/4 a cup of pineapple, and 1 whole wheat dinner roll. And then for day 4, for breakfast, we have 1 cup of 2% milk, a half a cup of oatmeal, 1/4 a cup of strawberries, and 1/4 a cup of blueberries. For the morning snack, we have water to drink with 1 peach and 1 ounce of walnuts. For lunch, we have 1 cup of 2% milk, a turkey wrap, so 1 whole grain tortilla with 2 ounces of turkey, 1/4 a cup of cherry tomatoes, and 1/4 a cup of avocado. And then to go with it, we have a half a cup of carrots. And then for our snack 2, we have water to drink, 1 hard-boiled egg, and a half a cup of grapes. For dinner, we have 1 cup of 2% milk, 2 ounces of grilled chicken, a half a cup of quinoa, and a half a cup of zucchini. And then lastly, day 5, for breakfast, we have 1 cup of 2% milk, 1 slice of whole wheat toast, 1 ounce of peanut butter, and a half a cup of mango. And then for snack 1, we have water to drink with 1 ounce of sunflower seeds and 1 small apple. And then for lunch, we have 1 cup of 2% milk, a cucumber tuna boat, so a half a cup of cucumber and 2 ounces of tuna. And then to go with it, we have 4 whole grain crackers and 1/4 a cup of grapes. For snack 2, we have water to drink, 3/4 cup of bell peppers, and 1/4 cup of hummus. And then for dinner, we have 1 cup of 2% milk, 2 ounces of grilled fish, a half a cup of brown rice, and a half a cup of Brussels sprouts. And then these are our sources. Thank you so much for watching our presentation on type 2 diabetes.